Hello, Assalamualaikum and good morning. So today I'm going to present the case study that was assigned to me, which is inadequate weight gain during gestational period. So for this case study, Mrs. Z is a woman aged 24 years old. She is a full-time housewife. Meanwhile, her husband is a lorry driver. This is her second pregnancy, and now her gestational age is 23 weeks, which is she is in her third trimester of pregnancy. So for the medical diagnosis or history or medical progress, she has previous pregnancy history of anemia, but during this pregnancy, her hemoglobin level is normal, which is more than 11 gram per deciliter. The diet diagnosis relation that I can rule out from her condition is that first, unintended weight loss related to inadequate food and beverage intake as evidenced by the diet history. Second diagnosis is that inadequate energy intake related to nausea and vomiting during pregnancy as evidenced by diet recall and patient statement. There was no medication that was prescribed to the patient except for the iron supplement. Let's see the assessment and interpretation part. Based on the notes that was given by the physician, she has lost about 1.5 kg within the last visit, which is about 4 weeks ago. She is now in her second trimester. Her pre-pregnancy weight is in normal BMI, and her blood pressure is also in the normal range, which is 100/60. This is her diet history. As we can see here, for the breakfast, normally she will have her breakfast at 8 a.m. and the food that she chose is the nasi bungkus, where her husband will buy from outside. As for the morning tea, she will have around 10 a.m. in the morning. She will have around 10 a.m. in the morning, and she choose to eat snacks such as kuih muih that was bought from outside also. As for the lunch, she will have around 2 p.m. in the afternoon, and she will always cook herself, which is white rice. She will either choose white rice with singgang or fried fish, and also vegetable soup. And for evening tea, she will have around 4:15 p.m. She will either have slice of white bread with margarine or butter spread along with 1 glass of rose syrup ice. And dinner she will have around 8:30 p.m. and she will buy the dinner from outside, which is nasi kerabu with roasted chicken, and also 1 glass of tea with sweetened milk. And for the other snacking, she will have either watermelons or mango, about 2 slices of medium size each. And sometimes she also have ulam-ulaman for her snackings. So for the nutrition diagnosis and intervention, the objective that mainly we can set for her is that the diet plan that is recommended for her must achieve the adequate calorie intake, must able to maintain the normal glycemic index of antenatal and postnatal, and also individualized meal plan according to her age, physical activity level, and also her gestational age. So based on this objective in mind, I have already given few advices for her. First is that she must always consume 3 main meals along with 2 snacks. Her total calorie for the day would be 2360 kilocal, whereas 360 kilocal is the additional kilocal she needed for her second trimester, and she must continue to eat supplement to aid for her nausea and vomiting, and also avoid fruit juice because it is high in sugar. Drink more plain water and milk, and to avoid occurrences of nausea and vomiting, she can choose to eat high protein food in the morning. So, based on these advices, here are the meal plan distribution that I plan for her. As for the breakfast, she can have 1.5 serving of carbohydrate food group such as 3 scoops of rice or 3 pieces of bread or 9 pieces of crackers or 1.5 cup of noodles, and along with 1 serving of protein food group such as 1 medium-sized fish, 1 piece of chicken thighs or 2 pieces of meat, 1 cup of cooked chickpea or 2/3 cup of anchovies, and 1 serving of vegetable which will be half cup cooked green leaf vegetables or 1 cup of ulam or 1 cup of cooked sayuran berbuah. And for the morning tea time, she can have 1 serving of carbohydrate food group and half serving for protein food group and 1 serving of fruits. For the lunch, she can have 1.5 serving of carbohydrate food group, 1 serving of protein food group and also 1 serving of vegetables. For the afternoon tea time, she can have half serving of carbohydrate food group, half serving of protein food group and 1 serving of fruits. As for the dinner, she can have 1.5 serving of carbohydrate food, 1 serving for protein food group and 1 serving of vegetables. As for supper, she can have 1 serving of dairy product, preferably milk. So she can take either 1 glass of milk, 1 piece of cheese, 1 cup of yogurt or even 4 tablespoons of milk powder. As for the nutritional monitoring and evaluation, there is follow-up at the antenatal clinic after 2 weeks to see the progress of weight gain after the individualized meal plan that was given to the patient. So for the discussion part, the nutrition education objective remain mainly is to regulate the maternal diet, constant monitoring of the patient's weight gain or weight loss, and also regulating or monitoring her dietary history. So the nutrition deficiencies is the main factor for the weight loss experienced by the patient. Inadequate weight gain during gestational period is related to infant having small gestational age and also preterm birth among infant. And there are few factors that can be the reason why a small gestational age infant and preterm birth delivery occur is that pre-pregnancy BMI, smoking status, physical activity level and also socio-demographic characteristic of the patient. As for the conclusion part, I can say that the patient was consuming less calorie intake than the recommended intake, and I already prescribed the right amount of food the patient should consume in order to gain weight accordingly to the recommended weight gain during the gestational period. That's all. Thank you.